Narcolepsy is described as excessive daytime sleepiness accompanied with sudden loss of muscle tone, also known as cataplexy, and sleep paralysis. It is also known as a disorder of REM sleep mechanisms with evidence of non-REM sleep and possibly circadian sleep-wake rhythm abnormalities.
Causes of narcolepsy are due to the lack of the chemical protein hypocretin, which regulates sleep. The immune system mistakenly attacks parts of the brain that produce hypocretin.
The above photos depict the number of hypocretin-producing neurons in a healthy person's lateral hypothalamus, shown on the left, compared to a person affected with narcolepsy on the right. As we can see, the number of hypocretin-producing neurons in a narcoleptic is lower than that of a healthy person.
Although it can occur at any age, symptoms are usually prevalent between the ages of 10 to 30 years old. The average time between the onset of symptoms and diagnosis is approximately 7 years.
Symptoms of narcolepsy include uncontrollable daytime sleepiness triggered by intense emotions, lack of energy and concentration, and loss of muscle tone, usually lasting from a few seconds to a couple minutes, all due to the decrease or loss of orexin neurons, which regulate metabolism, feeding, reward, and autonomic tone, resulting in additional symptoms. For example, weight gain is common at the onset of narcolepsy, especially in children, perhaps from a reduction in basal metabolic rate. Children affected with narcolepsy tend to have trouble doing well in school because they often experience problems with attention and memory, and they may find themselves falling asleep at school or during extracurricular activities. Narcolepsy affects 1 in 2,000 people in the United States and Western Europe. Worldwide, narcolepsy appears to be mostly prevalent in Japan, where it affects an estimated 1 in 600 people. It is said that the disease is common in Japan due to a genetic defect linked to narcolepsy, making it more prevalent in that part of the world.
Orexin A and B, which are also referred to as hypocretin 1 and 2, are the pair of hypothalamic neuropeptides present in the lateral hypothalamus. These neurons play an important role in wakefulness and transitioning between sleep and wake during the sleep cycle. The orexin neurons are essential in this mechanism. They excite many wake-promoting systems, including noradrenergic neurons found in the locus coeruleus, serotonergic neurons in the dorsal raphe, histaminergic neurons in the tubal mammillary nucleus, and cholinergic neurons in the basal forebrain and pons. They promote wakefulness and they obstruct sleep-promoting systems. When orexins are not present, the neurons that control wakefulness have no excretory drive. This leads to disruption of sleep-promoting pathways and falling asleep at random periods of time.
The above photo depicts the pathway of the orexin hypocretin neurons in the brain. Orexin neurons, which are present in the lateral hypothalamus, extend to the major nuclei that affect arousal and display their effects in those nuclei. Orexin acts by affecting the neurons that produce different hormones such as histamine, norepinephrine, serotonin, dopamine, and acetylcholine.
In this mechanism, noradrenergic and serotonergic neuron activity is suppressed, permitting atonia, which is when the muscles in the body lose their strength. The neurons that allow the body to remain awake are the histaminergic neurons of the tubal mammillary nucleus. They are responsible for keeping the person conscious. Orexin peptides could prevent atonia, exciting neurons such as VL-PAG, LPT, monoaminergic regions, and motor neurons. Emotions have an impact on atonia. Positive emotions promote atonia to occur. People with narcolepsy that experience emotions would activate pathways that lead to paralysis.
Due to the many symptoms that come with narcolepsy, there is not a single medication that treats all of these symptoms. Sodium oxybate has been an effective medication in treating most narcolepsy symptoms, which improves the quality of nocturnal sleep. It is important to provide patients of narcolepsy, especially newly diagnosed patients, with relevant education and techniques that they can use to effectively manage narcolepsy symptoms. These techniques can include setting a consistent sleep schedule so that patients can obtain as much sleep as possible throughout the nighttime.